9 surprising early signs of dementia, and 13 classic symptoms. You should know. Have you ever dismissed memory lapses as just a part of getting older, or wondered whether dementia is truly inevitable? It's time to unravel the mystery surrounding this condition that affects millions worldwide. Dementia is often misunderstood, with many assuming it's simply a natural consequence of aging. But is that the whole truth? In this video, we'll explore dementia in depth, what it really is, the most common types, and most importantly, how to recognize its early warning signs. We'll delve into 9 early indicators that might signal the onset of dementia, signs that most people miss until it's too late. Beyond that, we'll examine the 13 classic symptoms, giving you a comprehensive understanding of how dementia manifests. But that's not all. What if you could take proactive steps today to protect your brain health and reduce your risk of cognitive decline? We'll discuss proven strategies to maintain mental sharpness and explore the latest advances in treatment, offering hope and practical solutions for those affected. Stay with us to the very end. You'll not only learn how to identify these warning signs, but also discover actionable ways to safeguard your cognitive well-being. Let's empower ourselves with knowledge and take charge of brain health together. Ready to begin? Let's dive in. What is dementia really? Dementia is not a single disease, but a collection of symptoms that significantly impair cognitive functions, such as memory, language, reasoning, and behavior. It arises from damage or loss of nerve cells in the brain, disrupting daily activities and diminishing quality of life. While dementia primarily affects older adults, it is not a natural or inevitable part of aging. Instead, it is a condition requiring proper diagnosis and intervention. Breaking the myth, dementia is not normal aging. It's crucial to dispel the misconception that dementia is a natural consequence of growing older. While occasional forgetfulness is common with aging, dementia involves a pronounced decline that interferes with everyday functioning. Many older adults retain their cognitive abilities throughout their lives, and persistent memory issues or confusion warrant medical evaluation to rule out dementia or other treatable conditions. For key types of dementia you should know, understanding the different types of dementia is vital for early diagnosis and targeted care. Alzheimer's disease, the most prevalent form characterized by progressive memory loss, language difficulties, and behavioral changes. Vascular dementia, caused by reduced blood flow to the brain, often linked to strokes or circulatory issues. Lewy body dementia, marked by cognitive fluctuations, visual hallucinations, and Parkinson-like motor symptoms. Frontotemporal dementia primarily affects personality, behavior, and language, often in younger individuals compared to other types. 9 early signs of dementia that often go unnoticed. Struggling with words. Frequent difficulty finding the right words or naming everyday objects can signal early cognitive changes. People may hesitate, use vague substitutes, or misname items, making communication increasingly challenging. Sensory changes. Altered vision, hearing, smell, or taste can indicate early dementia. Struggling to recognize familiar faces, judge distances, or follow conversations in noisy settings are subtle but significant signs. Loss of motivation. Apathy and lack of initiative in pursuing hobbies or social interactions can be mistaken for depression, but may indicate early dementia. Muscle weakness. Weakness, fatigue, and difficulty with fine motor skills or balance are often associated with vascular and Lewy body dementia, potentially leading to falls or mobility challenges. Spatial disorientation. Getting lost in familiar places or struggling with simple navigation tasks highlights compromised spatial awareness and mental mapping. Sleep problems. Insomnia, frequent awakenings, or a reversal of the sleep-wake cycle, e.g., sundowning, can signal cognitive changes. Postural and walking changes. A hunched posture, muscle stiffness or shuffling gait, particularly in Lewy body or vascular dementia, can impede mobility and increase fall risk. 8. Simple tasks. Becoming overwhelming. One of the hallmark early signs of dementia is difficulty with routine tasks that were once second nature. Activities such as preparing a meal, paying bills, or operating common household appliances can suddenly feel complex or impossible. The person might struggle to remember the sequence of steps required to complete these tasks or forget key elements altogether. These difficulties often lead to mistakes, frustration, and a growing sense of dependence on others. Paying attention to noticeable changes in how daily activities are performed can be critical for early detection and support. Losing interest in social interactions or conversations. Apathy, or a lack of motivation and interest, is another frequent early sign of dementia. Known clinically as anhedonia, it manifests as disengagement from activities, hobbies, or social interactions that once brought joy. The person may become emotionally distant, showing little enthusiasm for conversations or events. Unlike depression, which is often accompanied by profound sadness, dementia-related apathy is usually characterized by a lack of energy and indifference rather than deep emotional distress. Addressing this symptom is vital as it can significantly impact relationships and overall quality of life, necessitating tailored support and interventions. Taking action. If these signs persist, it's essential to seek a medical evaluation. Early diagnosis not only facilitates better care, but also opens up opportunities for interventions that can slow cognitive decline and improve quality of life. By staying informed and vigilant, you can take proactive steps to protect your brain health and support those who may be at risk. 13 classic symptoms of dementia. You need to recognize total disorientation in time and space. A classic symptom of dementia is disorientation, where individuals may lose track of time, dates, or their surroundings. For example, they might forget the current season, get lost in a familiar neighborhood, or even struggle to find their own home. This disorientation can create significant confusion, anxiety, and vulnerability to dangerous situations. To manage this, tools like labeled landmarks, calendars, and consistent routines can be incredibly helpful. Difficulty planning or solving problems. Problem solving and planning become increasingly challenging for those with dementia. Tasks that require organization, such as balancing a checkbook, managing appointments, or preparing meals, may feel insurmountable. Mistakes and confusion can lead to frustration and an increased reliance on others. Simplified instructions and step-by-step guidance can help mitigate this issue. Placing objects in inappropriate places. Misplacing items in unusual locations is a common sign of dementia. For example, keys might end up in the refrigerator or shoes in the oven. This behavior often leads to confusion and even accusations of theft when objects can't be found. Establishing designated spots for essential items and patiently helping to locate lost objects can reduce stress for both the individual and their caregivers. Mood or behavioral changes. Dementia often triggers dramatic mood swings or behavioral shifts. A person might experience sudden irritability, sadness, or inappropriate laughter without obvious cause. Behavioral changes such as increased aggression, apathy, or inappropriate actions like sexual disinhibition can also occur. These symptoms may strain relationships and challenge caregivers. Empathy, understanding, and specialized communication strategies are key to managing these changes. Urinary or fecal incontinence. In more advanced stages of dementia, individuals may lose control over their bladder or bowels. They may not recognize the need to use the bathroom or struggle to locate it in time. This can lead to embarrassment and hygiene concerns, increasing caregiver stress. Regular bathroom reminders, accessible clothing, and incontinence aids can help manage this sensitive issue effectively. Hallucinations. Hallucinations are a possible symptom of dementia, particularly in Lewy body dementia. Individuals may experience vivid and often frightening visual hallucinations, such as seeing people, animals, or objects that are not there. Auditory hallucinations, like hearing voices, can also occur. Management tips. Validate the person's feelings without arguing about the reality of the hallucination. Use gentle redirection strategies to shift focus. Consult healthcare providers for appropriate medications or interventions. Short-term memory problems. A hallmark of dementia, short-term memory issues manifest as frequent forgetting of recent events, conversations, or appointments. Individuals may repeat questions or stories, unaware they've already shared them, while long-term memories often remain intact initially. Management tips. Use tools like written reminders, photos, or life stories to help recall events. Practice patience and provide gentle prompts to reduce frustration. Social isolation. People with dementia may withdraw from social activities, avoiding interactions due to cognitive or communication difficulties. They may feel uncomfortable or stigmatized in social situations, leading to further withdrawal and accelerated cognitive decline. Management tips. Encourage participation in dementia-friendly activities and support groups. Create a safe, understanding environment to foster social engagement. Inappropriate behavior. Dementia can cause disinhibition, leading to behaviors such as saying or doing socially inappropriate things, inappropriate sexual advances, or verbal and physical aggression, especially during personal care. Management tips. Remember, these behaviors are symptoms of the disease, not intentional actions. Use calm communication and redirect attention when necessary. Modify the environment to reduce triggers. Repeating questions. Repeatedly asking the same question stems from short-term memory problems. This behavior can be tiring for caregivers, as the individual forgets they've already received an answer. Management tips. Respond with patience and understanding. Use simple, direct answers and visual or written reminders to address the repeated inquiries. Difficulty following conversations. Individuals with dementia may find it hard to keep up with discussions, particularly in noisy environments. They may lose track of conversations, struggle to find words, or express themselves clearly. Management tips. Speak slowly and clearly, using short sentences. Minimize background noise and distractions. Allow extra time for the person to process and respond. Loss of time awareness. Temporal disorientation is common in dementia. Individuals may confuse the day, month, or even year, and may struggle to remember important dates. The passage of time may feel distorted, with recent events seeming far away or vice versa. Management tips. Use tools like calendars, clocks, or structured routines to help maintain orientation. Provide consistent reminders of the current time, day, or upcoming events. Difficulty making decisions. Dementia can impair decision-making abilities, making it hard to weigh options or come to conclusions. Simple decisions, such as choosing what to eat or wear, may become overwhelming, while complex ones, like financial matters, become increasingly unmanageable. Management tips. Offer limited, straightforward choices. Provide extra time for the person to consider their options. Assist with complex decisions in a supportive, non-overbearing manner. Recognizing these symptoms can help caregivers provide better support and create strategies to enhance the quality of life for those affected. Patience, empathy, and tailored interventions are key to managing the challenges posed by dementia. Dementia is a multifaceted condition caused by various underlying factors, with Alzheimer's disease being the most prevalent. In Alzheimer's, abnormal proteins, such as beta-amyloid plaques and tau tangles, accumulate in the brain, leading to nerve cell death and progressive cognitive decline. Other significant causes include vascular dementia. resulting from brain damage caused by circulatory issues like strokes or chronic hypertension, Lewy body dementia, marked by the accumulation of the protein alpha-synuclein, leading to disruptions in brain function. Frontotemporal dementia, targeting the brain's frontal and temporal lobes. This form affects behavior, personality, and language skills. Key risk factors include advanced age, a family history of dementia, cardiovascular diseases, and unhealthy lifestyle choices. Preventing dementia. 1. Managing diabetes effectively is a critical step in reducing dementia risk. High blood sugar levels damage blood vessels, impairing brain function and increasing the likelihood of cognitive decline. Adopting a balanced diet, engaging in regular physical activity, and taking prescribed medications can help keep blood sugar levels in check. Proper diabetes management also promotes cardiovascular health, another protective factor against dementia. 2. Smoking significantly increases the risk of dementia, particularly vascular dementia, as it damages blood vessels and limits oxygen flow to the brain. Quitting smoking, even later in life, offers immediate and long-term benefits for brain health. Utilize resources like nicotine replacement therapies, counseling, and support groups to make quitting more manageable. 3. Chronic stress negatively impacts brain health, affecting memory and overall cognitive function. Incorporate stress-relieving practices such as meditation, deep breathing exercises, or yoga into your daily routine. Additionally, maintaining strong social connections, pursuing enjoyable hobbies, and finding a healthy work-life balance can bolster mental well-being and reduce the risk of cognitive decline. 4. Keeping your brain active is one of the most effective ways to build cognitive resilience. Engage in mentally stimulating activities like solving puzzles, playing word games, learning a new language, or taking up a musical instrument. Intellectual pursuits such as reading, writing, and participating in thought-provoking discussions also strengthen brain connections and enhance neuroplasticity. The key is to enjoy the process and vary activities for maximum benefit. 5. Regular physical exercise is essential for brain health. It improves blood flow, delivers vital nutrients and oxygen to the brain, and promotes the release of growth factors that support neuronal health. Aim for 150 minutes of moderate aerobic exercise per week, such as brisk walking, swimming, or dancing. Complement this with strength training and balance exercises to maximize benefits. Choose activities you enjoy to ensure consistency and long-term adherence. 6. Social interaction is a powerful tool in dementia prevention. It stimulates the brain, enhances emotional well-being, and reduces the risk of isolation, a major contributor to cognitive decline. Consider joining group activities like book clubs, art classes, or volunteer organizations. Nurturing meaningful relationships with family and friends also provides emotional support and opportunities for cognitive stimulation, strengthening brain health over time. 7. Good sleep is essential for cognitive function, memory consolidation, and the removal of brain toxins that accumulate during waking hours. Establishing a consistent sleep routine, creating a calming sleep environment, and avoiding screens before bedtime can improve the quality of your rest. If you suffer from sleep disorders like sleep apnea, seek treatment promptly to ensure restorative sleep and protect your brain health. Dementia may not yet have a cure, but you can take significant steps to reduce your risk and maintain cognitive health. By controlling conditions like diabetes, quitting smoking, managing stress, and adopting brain-boosting habits such as regular exercise and intellectual engagement, you can fortify your mind against age-related decline. Remember, every small lifestyle adjustment adds up to a brighter, healthier future for your brain. Take proactive steps today to safeguard your cognitive vitality for years to come. Maintaining a healthy weight isn't just about physical appearance. It's a vital strategy to safeguard brain health and reduce the risk of dementia. Obesity, especially during middle age, is linked to a significantly higher likelihood of cognitive decline and dementia. This is because excess weight can disrupt vascular health, increase chronic inflammation, and impair brain function, all of which are critical to maintaining cognitive sharpness. To combat these risks, focus on adopting a balanced, nutrient-rich diet. Incorporate plenty of fruits, vegetables, whole grains, and healthy fats, such as those found in avocados and olive oil. Pair this with regular physical activity to not only shed excess pounds, but also enhance overall brain health. Small, manageable lifestyle changes, like swapping sugary snacks for nuts or choosing stairs over elevators, are more effective and sustainable in the long run. Your brain will thank you for prioritizing a healthy weight. 9. Did you know your brain has a backup system that helps it withstand damage? This is called cognitive reserve, a remarkable ability to maintain mental function despite age-related changes or disease. Think of it as a mental safety net, built through lifelong learning, challenging work, and engaging hobbies. Research shows that people with higher cognitive reserves are better equipped to handle the effects of aging or even brain-related diseases. So take up a new language, try chess, or dive into a book club. Activities that challenge your mind not only enrich your life, but also fortify your brain against potential decline. It's never too late to start building this invaluable resilience. 10. The old adage, "You are what you eat," holds especially true for your brain. A nutrient-dense diet is essential for optimal cognitive function and long-term mental health. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, olive oil, and nuts, has been linked to a lower risk of cognitive decline. For added benefits, incorporate foods high in omega-3 fatty acids, like salmon and walnuts, and antioxidants, such as berries and spinach, which protect your brain from damage. Equally important is reducing your intake of processed foods, added sugars, and unhealthy fats. By improving your diet, you're not just feeding your body, you're nourishing your brain, setting the foundation for a sharper mind as you age. 11. High blood pressure and cholesterol aren't just bad for your heart. They're also major contributors to cognitive decline and vascular dementia. These conditions damage blood vessels, restricting the oxygen and nutrients your brain needs to thrive. To combat these risks, adopt heart-healthy habits, engage in regular exercise, practice stress management techniques, and follow a diet low in sodium and saturated fats. If needed, consult your doctor about medications to keep your levels in check. By managing your blood pressure and cholesterol, you're not only protecting your cardiovascular system, but also giving your brain the care it needs to function at its best. The landscape of dementia treatment is evolving rapidly, offering hope for those at risk or already affected. While no cure currently exists, promising developments include medications designed to slow cognitive decline and alleviate symptoms. Non-drug therapies like cognitive stimulation and tailored social activities have also shown great potential in improving quality of life. Exciting breakthroughs in early detection, such as advanced biomarkers and imaging technologies, may allow for timely interventions. Cutting-edge approaches like immunotherapy and gene therapy are on the horizon, bringing us closer to disease-modifying treatments. Dementia is a complex and widespread condition, but there are actionable steps you can take to protect your brain. Recognizing the signs early and embracing a proactive lifestyle through weight management, cognitive stimulation, and a nutritious diet can significantly reduce your risk. As science advances, the outlook for dementia treatment continues to improve, offering hope for a healthier future. Take charge of your brain health today. It's one of the best investments you can make for a lifetime of mental clarity and well-being. Don't forget to subscribe to the channel for more tips on maintaining a healthy mind and body. Together, Let's pave the way for a brighter, dementia-free future.